Hey, I'm back. This time I had ChatGPT make a quiz based on the categories that'll be on our exam too, and I also had her um, base the questions using the client needs categories. So I'm gonna take it. I haven't looked at it yet. I mean, I looked at the first question because it's right here, but I haven't looked at it. I'm just gonna take it and I'm gonna do it exactly like the other ones. If I don't know right off the top of my head, I'm gonna talk through why I think it is what it is. Okay, so number one. A 3-month-old with tetralogy of Fallot suddenly becomes cyanotic and irritable. What is the nurse's first action? A. Administer oxygen. B. Place the child in knee-chest position. C. Notify the provider. And D. Prepare for intubation. And I am going to go with B. Okay. Oops. Number 2. Select all that apply. Which findings are expected in a child with coarctation of the aorta? A higher BP in upper extremities than lower. B. Weak femoral pulses. C. Bounding lower extremity pulses. D. Cool lower extremities. E. Clubbing of the fingers. Okay, so I'm definitely going to go with A because I know that, excuse me, I know that that's like the first sign of it. Weak femoral pulses. Um, yeah, I'm gonna choose that too. Okay, C. Bounding lower extremity pulses. No. D. Cool lower extremities. Yeah, I think so. Clubbing of the fingers. Mm, I don't, I don't think so. Yeah, I'm not gonna choose E. I don't think it is. Okay, 3. A newborn with transposition of the great arteries, sorry, becomes severely cyanotic. Which medication may be administered to maintain ductal patency? A. Indomethacin. B. Prostaglandin E1. C. Furosemide. D. Digoxin. And I am gonna go with B. I'm gonna go with B because prostaglandins are what keeps the patent ductus, whatever, arterial, the PDA open. You want it open because the transposition of the great arteries is the one that just keeps pumping each side in a circle. So you want to keep the PDA open so that they're getting some oxygenated blood with the deoxygenated blood. Okay. Number 4. A child with VSD develops signs of heart failure. Which finding requires immediate intervention? A. Mild tachycardia. B. Sweating during feeds. C. Weight gain of 2 pounds in 24 hours. D. Poor appetite. I'm gonna go with I'm gonna go with sweating during feeds. Yeah. Okay. Poor. Okay. Moving on to hematology. A child with sickle cell anemia reports severe leg pain. Which intervention is priority? A. Encourage ambulation. B. Apply cold compresses. C. Administer IV fluids. D. Restrict oral intake. Mm, um, probably C. Mm, yeah, I'm gonna go with C. Okay. Select all that apply. Which of the findings are consistent with iron deficiency anemia? Um, okay, so you've got pica, B. Pallor, C. Spoon-shaped nails, D. Jaundice, E. Fatigue. Iron deficiency anemia. So I'm definitely going to say A. Pretty sure it's that. Pallor. Yeah, I think also pallor. C. Spoon-shaped nails. Yes, I think yes. I know one of the hematologic disorders causes spoon-shaped nails. I'm not sure that it's iron deficiency anemia. Jaundice. They don't. I don't think so. I'm not positive. I'm gonna choose E as well because I feel like all of the anemias make you fatigued. Okay, 7. A child with hemophilia falls and hits his head. What is the priority action? A. Apply ice. B. Assess level of consciousness. C. Administer IM injection of factor. D. Encourage rest. Um, hmm. I don't. I'm pretty sure it's not A. I'm pretty sure it's not D. I don't know if assessment is an action. I mean, I guess it's an assessment. You're doing something, but I don't know if you would just immediately administer factor 8 or whatever it is. I'm gonna go with B. I feel like you always assess first. I guess. Okay. Number 8. A child with suspected DIC would most likely have which lab findings? Elevated platelets, prolonged PT and PTT, increased hemoglobin, decreased D-dimer. Okay, so I'm pretty sure it's increased D-dimer, so I'm not going to choose D. Um, I don't think it would be elevated platelets. I think it would be B, prolonged clotting times, maybe? I'm going to choose B, I don't know. Which finding is most concerning in a child with lead poisoning? A. Irritability. B. Constipation. C. Developmental delay. D. Blue line on gum. I actually don't know the answer to this, but a developmental delay is going to be down the road, so I don't think it's that. Um, Irritability and constipation could be a number of things. Um, so I'm going to go with D. I don't even know if that's an actual finding of lead poisoning, but sounds reasonable. Okay. Immunology. Select all that apply. A child is experiencing anaphylactic shock. Which findings would the nurse expect? Okay. Sorry. Stridor, hypotension, bradycardia, wheezing, facial swelling. I would say you hear stridor when there's like a blockage and the throat would be swelling shut, blocking it. So I'm gonna go A. Hypotension. Mm, okay, I'm gonna say B. Oh, B. I don't think it's bradycardia. I don't know if they would use maybe, uh, maybe. I don't know. And then E. I was saying yes. Maybe. I'm not sure. Okay. A child with SLE. SLE is systemic lupus, whatever the last word is. Reports fatigue and joint pain. Which additional finding is expected? A. Butterfly rash. B. Productive cough. C. Elevated white blood count. D. Hyperactivity. Um, I'm going to go with A. Okay, 12. Which vaccine should not be given to a child with HIV/AIDS who is severely immunocompromised? IPV, MMR, hepatitis B, DTaP. This is 12. So they can't be given live viruses, and I think the only live virus off of here is the MMR, so I'm going to go with B. Okay, renal urinary. A child with glomerular nephritis is admitted. Which finding is expected? A. Massive proteinuria. B. Tea-colored urine. C. Hypotension. D. Hypokalemia. And I'm going to go with B. 14. Select all that apply. Teaching for parents of a child with vesicular oh my god, ureteral reflux should include A. Encourage frequent voiding. B. Complete full course of antibiotics. C. Restrict fluids. D. Monitor for fever. E. Avoid Bovasts. So I know, well, I think A for sure. I don't think you get antibiotics for that. C, we're not going to restrict fluids. D, I mean, we can monitor for a fever because I guess if it's backing back up into the bladder, it could bring bacteria. And E, I'm going to choose E as well. I'm not positive. We'll see. Okay, 15. A toddler with nephrotic syndrome has periorbital edema. Which lab value is expected? A. Low albumin. B. Elevated hemoglobin. C. Low cholesterol. D. Low protein in urine. Um, I would go with A. I chose A just because I know that nephrotic syndrome has something to do with albumin. The the I don't know. I can't explain it. It's something like the glomerulus whatever doesn't filter correctly, and then albumin escapes. So I don't know if that means it would be low. I guess it would be low. I don't know. Anyway, all right, 16. A 6-week-old infant with pyloric stenosis would most likely present with A. Um, bilious vomiting, projectile vomiting, bloody stool, or diarrhea. And I'm going to go with B. A child with intussusception would most likely have A. Current jelly stools, B. Clay-colored stools, C. Steatorrhea, I don't know what that is, and D. Hematoemesis. Hematoemesis. Um, I'm going to go with A because I know that's right. Oh, that's 18. Okay. A child with suspected appendicitis is admitted. Which action is contraindicated? A. Keep NPO. B. Apply heat to abdomen. C. Administer IV fluids. D. Monitor temperature. And the answer is B. Okay. Select all that apply. Which findings are consistent with failure to thrive? Weight below the 5th percentile, developmental delay, excessive weight gain, poor feeding, decreased subcutaneous fat. And I'm going to go with A. Okay, so B, I mean, they would have a developmental delay if they're not, getting the nutrients they need to grow. But I don't know the way the question asks. I'm not sure if it's asking that if someone's, if the baby is currently considered failure to thrive, would they currently have a developmental delay? Or is that something that can happen from it? I'm I'm gonna say B. Okay, C is not right. D is yes. E is yeah. Okay. Oh, that's all of them. Okay, so let's grade me. Oh, okay. 1, B. Yay. 2, A, B, D. Yes. 3, B. Yes. 4, C. Well, 5, C is correct. 6, A, B, C, E. A, B, C, E. Got that right. 7, B. Okay. 8, B. Yes. 9, C. I got that wrong. 10, A, B, D, E. 11, A. 12, B. 13, B. 14. A, B, D, E, so this is kind of wrong. I need to see B. 15, A, 16B, 17A, 18B, 19A, B, D, E, A, B, D, E. Got it right. Okay, so I missed, I don't know, maybe. Okay, so I missed 2, and then, I missed 1 of 4 here. So, alright, let's go back up, and we will check them off by question. Okay, so 1 is B. Oh, I can't write on this, I forgot. Okay, so 1 is B. Place the child in his chest, yeah. 2 is A, B, D. A, B, D. Okay. 3 is B, prostaglandins. 4 is C, weight gain of 2 pounds in 24 hours. Okay. I mean, I knew that that was an issue, but I think, yeah, I don't know why I chose the other one, but whatever. Okay, so we know weight gain is the immediate intervention. Okay, 5 is administer IV fluids. 6 is A, B, C, E. 7 is B. 8 is prolonged PT and PTT. 9 is C, developmental delay. Okay. And then 10 is stridor, hypertension, wheezing, facial swelling. 11 is butterfly rash. 12 is MMR. 13 is tea-colored urine. 14 is A, B. So this is with vesicoureteral reflux. And I wasn't sure if you take antibiotics for that, but I suppose you do. So you are going to do the frequent voiding, the complete full course of antibiotics, monitor for fever, and avoid bubble baths. Okay. 15 is low albumin. 16, oops, okay, 16 is projectile vomiting. 17 is current jelly stools. 18 is apply heat to abdomen. And 19 is weight below 5th percentile, developmental delay, poor feeding, and decreased subcutaneous fat. I don't know what my grade is, but out of 19, I missed 2, and I got 50% of that right. So 2.5. I think that's pretty good. Alright, bye.